Hi everyone, we are here again to discuss another topic of interest regarding our health and way forward to look after ourselves, because it is said that health is wealth. Before you're able to achieve anything in life, you have to be healthy. If you're not healthy, you will not be able to do much or anything. Therefore, before I go forward, I just want to thank each and every one of you who are watching me at this point in time. And I want to also use this opportunity to thank all my subscribers and my viewers and people who are supporting me in one way or the other. I bring greetings to each and every one of you, and I say may God bless you all. In Jesus' name, amen. And please, before I go further, I just want to make a disclaimer. Please, I don't have any charity organization. I don't own any orphanage. I don't do any cryptocurrency as to ask anybody for anything, for money, or to, donate money for anything whatsoever. Please, in case anybody comes across to you with my name or my channel, Holistic Living by StellaeZiada, please do not yield. Don't give any money. It is not from me. Please. Thank you very much. And today, we're going to continue on. Last time, just to make a little recap, last time we discussed about stress, the causes of stress, the effect of it on our body, how we can manage it to overcome the effect of it. And we came to the end of it, and we concluded by saying stress can lead to something worse than ever, into situations that will be so much, have a very adverse effect in our bodies. And we said we're going to discuss that in another topic, which we are coming today. And what is it all about? It's about anxiety. And then following anxiety is depression. So today we're going to talk about anxiety. We're going to talk about anxiety. What does it do to us? What is it anyway? What does it do to our body? How do you realize somebody is having anxiety? It is not an easy something as we might think it to somebody who say, I am anxious, or no, it's more than that. And what other thing it can even lead to. Okay? So anxiety is said to be a natural human emotion that involves feelings of fear, fear, dread, uneasiness. When one is, having anxiety, it is a situation that is mostly involving our emotions. The emotions, you get so afraid, you get so dreadful, you feel so drained, so dreadful, so unease, so uncomfortable, and it is part of body's, a sort of fight and flight. You feel like you want to fly off, you want to run away when a trigger of anxiety has come upon somebody. It's just a response to stress. We discussed stress last time, and we said stress can lead to anxiety. And the sister one, we can call it a sister one, depression, which is still the worst part of what we're talking about. Okay? And then when you perceive the stress, it can be as a sort of danger. One is in danger, that is when you start feeling that type of flight and fight. You want to fly, you want to fight back. Maybe you want to fight back the trigger, the source of the problem. Or maybe somebody come with something like it want to hurt you. Out of that, it triggers you to like flying up or trying to also, fight back, and is really, really a response to stressful life, you know. And then while it can be also normal reaction to feeling threatened or under pressure, it can become a problem if it interferes with daily life. If all this fear, all this fight and fear and flight response of danger and stress, if it continue without being controlled, it interferes with life, your daily activity, you know, and this can lead to anxiety disorder, which has now been a sort of diagnosis. One has been diagnosed now to be having anxiety disorder, which is not good for our body. You can't concentrate, you can't do anything. It is not a very good state of emotion to be in, you know. And in these cases, it can manifest in certain ways, especially it starts by manifesting in one being so excessively worried. You worry a lot excessively. You are so afraid every time. You're so apprehension. Everything gives you concern, you know. And there are other lots of signs and symptoms one can experience, which is just a very, very a bad situation for one to find yourself into. And you need to have to fight it so that you can get out of it. That's why we're bringing awareness. Yes. And we don't want it to land you into depression. From anxiety, it goes into depression if it continues daily, on and on, persistent without getting controlled. And depression is worse than anxiety itself. And depression can be said to be a persistent sadness and loss of interest in an activity, in every activity. And the one feeling so low, don't even want to think about anything to do. One does not want to handle anything again. And this again affects the daily activities. When you're only sad, every time you're sad, you are so depressed. You are so lost in everything. You lost interest in everything. You don't want to do anything. Sometimes you don't even want to take care of yourself. You don't even think about what am I gonna eat. You don't even think before you eat. You keep snacking anyhow. You eat anything. You grab anything you see across you. You start drinking anyhow. You start taking drugs. You start taking all sorts of things goes into your mouth. And even sometimes the person might not even think of common having a shower, common cleaning up himself, or the person just decided to just be like a zombie. Depression. And this starts from stress. Remember, we talked about it. And then into anxiety. And then into depression. And most of the time, anxiety and depression, they go hand in hand. Yes, they tend to go hand in hand. And this is not a good situation. Sometimes people are into it. They don't even know. They don't even know. And in it all, we just want to find out talk about what can be the cause of all this. Apart from, things around you. Sometimes it could be genetic. Some families might be known to be having a lot of, anxiety and depression. Depression, anxiety disorder, and depression, can be a sort of brain change. Maybe one has accident or has any problem with the brain, and then it start behaving, perceiving things in different ways and affecting the person's mood and motion and thinking and everything. It might be chemical imbalances in the body, It can also be environmental factors such as trauma, and stress, as we talked before. Stress can lead to anxiety and depression and trauma. Maybe one had an accident in the past, or somebody you know had a very serious accident or something like that. It can cause you stress. From stress if not controlled, if not taken care of, it then leads to anxiety, especially when it comes to a debilitating factor that maybe from the trauma, maybe from the accident, the person becomes disabled and things like that. These are the causes and many more. And then we now talk about how to cope with anxiety. How do we cope with anxiety? Or how do you help somebody around you to, or have been diagnosed to have anxiety or in depression? Number one, you start by doing what we call breathing exercises. 3 things to try first: breathing exercises, physical activities, talking to others, people, friends, family, socialize. Go to, club group, go to pair group of people that you can talk with, socialize and hear their own story, life story. That might also help you. And then when we talk about the breathing exercise, it's just what you need to do is take a deep breath. Breathe in deeply and hold it for 5 seconds. And then you exhale for 5 seconds then. And then you do it, you continue as much as you can count. You breathe in, you hold it there for 5 seconds. You breathe out then and wait again. And then you repeat that. And it keeps you calm. It keeps you calm. It helps you to calm down. To calm down. When you are anxious, the whole body start being like hot, like shots. You want to run, you want to fight, So, but when you do this breathing exercise, you're able to calm down. And then you start counting your breath as well. You are counting your breath. And this helps to distract you from negative thoughts. When you're counting, count it out. You can count 1, 2, 3, 4, 5. As much as you can. And as you're doing it, you're only concentrating on what you're counting. Whatever that has triggered the thought, that has triggered the stress or anxiety at that moment, will just be disappearing. Another thing you can do also is make the breath longer. You breathe longer. Okay? And this can help you to slow down your heartbeat, the heart rate. When you breathe longer, okay, you breathe longer before you come down, it helps the heart to slow down in beating fast, because when that stressor of the anxiety had come in, as we said, fright and fight, tremor and all sorts of things, irrational movement and all jerking and things. With this long breathing, you'll be able to calm down, So make it longer and slowly, and then it calms you down. It's just a trick to your body to calm down. It helps your body to calm down. Then remember, we said we have 3 things we can do to cope with anxiety. We've talked about breathing exercise. The next one, the second one, is physical activity. Go for a walk. Go out for a walk. If you like yoga, fine and good, you can do that. Or just pilates, everything that you can use to stretching out your body. You can do some little stretches in your house, at home. Okay? Then you do gentle stretches. It doesn't have to be a strenuous one. Gently, you stretch your body, you're exercising your body at this point in time, and this will help you. Okay? And then we said, talk to somebody. That's the third one. Say, tell family members or friends how you feel. Don't keep it to yourself. Don't keep your problem, how you feel, or what you're going through. Please don't keep it to yourself. Discuss it with somebody. You'll definitely find help. And the next one, is to get these people to support you through it all. Because once you tell people who are trustworthy, and people who are friends, who are really friends in need and in friends indeed to you, they will definitely help and support you through it all. Then we come to other little things we can also do. One can also do when you're going through anxiety, depression. You practice mindfulness. This means live in this present. So think about what is happening to you now and, sort it out. Think about in the now. Do not worry about yesterday's issue, things that has happened in the past. Do not worry about the past that has happened and gone. Don't go there visiting it, or what will happen tomorrow, or what tomorrow will bring. Just be mindful to be present, to think about present, what is in the now. Leave yesterday alone, is gone. It's not coming back. And then live tomorrow as well, because you're not there yet. Just think about what is happening here, now, at this moment, and handle it. And then, next tip is please avoid drugs, alcohol, and smoking, and caffeine. I repeat, avoid drugs, avoid alcohol, avoid smoking, and avoid caffeine. Because with anxiety, it brings a lot of panic. With caffeine, it makes it worse. Seek help from therapists. That's the next point. Seek help from therapists or counselors before it goes into severe anxiety, which is the next step to depression. And then we have the severe anxiety, as we said. This now manifests with intense, persistent worry and fear that significantly disrupt your daily activities. The worries become so intense, it becomes persistent. With fear, every time you live in fear, you are always afraid. Even if somebody calls your name, you shudder, you panic. Every little noise, you jump, because you are always afraid at this point. That is when the anxiety has become severe, and it keeps on. You can't concentrate to do anything. Even if you have something in your hand doing, any little movement, any noise, even if somebody calls your name, instead of you just to concentrate and just answer, you panic, you jump. These are also accompanied by other physical symptoms like rapid. Then by that time, every time your heartbeat keeps being rapid, very, very fast, and you sweat most of the time. You tremble most of the time. Your trembling can even be your hand, your legs, your head, every part of your body will be shaking and trembling. This is severe anxiety. We want you to take note so that when all these things are happening, you know what to do. You don't keep quiet. Please seek help. Seek help. And then we have the emotional, symptoms of anxiety. Intense. Number one we talked about is intense and persistent worry, which we have said before, or fear. It can be as a result of situation or wide range of everyday situation or activity or sense of impending doom. Maybe you're always afraid of, maybe somebody is not well and you're thinking, is this person gonna gonna survive or something like that, or is there any terrible thing that you always think that might happen? It might not be there, it might not gonna happen, but because you're always in that anxiety disorder state, you're always thinking, oh, something is going to happen. Oh, I think something is wrong is going to happen. Oh, I think it's something wrong is. You're always thinking about negative things, negative result, negative situation, negativity every time. You don't even think of positivity anymore. You know, because your worrying and your fear is so intense and is so persistent, you know. And then number two is difficulty concentrating or making any decision. In situation like this, you can't even think straight or make proper decision of what you not need to do. To look after yourself, no, you can't. Look after other people, you can't. You know, as a family member, maybe a father, you can't even think of how to go ahead and think about taking care of your family. As a mother, the same thing. And the workplace, maybe you keep on making serious mistakes, or you sometimes you even forget that you need to go to work. They keep looking for you at work. A lot of things being disorganized. And then another thing is you find it difficult to sleep and find it difficult to stop worrying. You know, and you see it as a irritational situation that it's just like something that now irritates you, but you don't know how to handle it. Rather, the situation you're into is making everything worse. And the third one we're talking about here is sense of being overwhelmed or on edge. Everything has become so much heavy on you. Everything looks like you think that there'll be no solution for any problem, that no problem can be solved. But that is the negativity the enemies try to bring in your heart, in your mind, and makes your emotion to just be in disarray, and for you to be unease. And this also makes you to feel nervous most of the time. You feel nervousness. Somebody looking at you, you're just like, we notice that something is not right. You're unease. You're so nervous. Or any approach of anything, for you to do or explain yourself, you will not be able to do that. You're very nervous, even to explain, express yourself, or to maybe for an interview, you are so nervous. If at all you'll be able to attend the interview at all, then you become so irritable and restless. You're always restless. Every little thing irritates you just because of anxiety, because of the stress that led to us, that was not taken care of, that you did not just keep things to yourself. Maybe you did not tell anybody, you did not let anybody to help you, and all this thing now starts to develop and increase in intensity, going from worse to worse. And then another thing, you start being avoiding people, avoiding every situation, avoiding everybody around you, avoiding people around you. You don't want to at all, you don't want to associate with anybody, even You don't even want to see, especially the people, maybe somebody has caused you to find yourself into the situation you are, or somebody has caused you harm in the future, and sorry, in the past. You don't want to see the person anymore, or when you see the person, you don't, when you see the person coming, you don't even want that person to come near you. Even when that person is coming for, maybe it's coming to make amends, you don't even want it at all. We've talked about sleeping. You can't find sleep at all. You panic, dreadful feeling, sudden onset of intense fear and discomfort. Everything is so uncomfortable. You can't sit one place, you can't lie down one place, you can't stand there, so you're just all over. Everywhere is just so irritating to you. And then we talked about the physical symptoms before, but we just want to, reiterate it again. Rapid heartbeat and palpitation. Feeling like the heart is racing. It's like your heart is trying to run away, run out from your body. Sometimes some people will say they're even hearing their heartbeat, that their heart is pounding. They can even hear it, Then you have increased breathing rate or shortness of breath, SOB. You can, every little thing you're panicking. You can't even breathe anymore very well. Then you keep sweating, excessive and unprovoked sweating. You're not doing anything. You're not doing any hard job, but you find yourself sweating. This is not life to live. We need to do something. Why are we bringing awareness? So for you to know, because some people can be having all these things, they don't know what is wrong with them. And they don't want to tell anybody. They keep things to themselves. And then, as we were saying, you have trembling and shaking, hands are shaking, other parts of the body shaking, anxiety. And then the muscle tensions and the aches all over. Stomach ache, nausea, diarrhea. Some people start having diarrhea, unexplained diarrhea. Dizziness, lightheadedness, so many things. Dry mouth, the mouth is always dry. Tingle, pins and needles. So many, almost all the systems of the body are always affected because of anxiety. We started from stress, unmanaged, uncontrolled, long-term stress leading to all this. And fatigue and tiredness. Most of the time you don't find strength in you anymore. And then how do we manage anxiety? We have talked about how we cope. Then what is the management? It can be a combination of management of what we call CBT. That is cognitive behavioral therapy. And then combination of that and medication. And cognitive behavioral therapy is talking to therapy, talking to the person. We talk a little bit about it. And then it says that medication is effective but can result in what we call dependency or drug addict, dependency or addiction, wanting to remain on that drug every time because you feel with that drug you get relief or something like that. You don't want to get out of the medication in life. You just want to depend on it for life. Who wants to remain on medication for life? I don't think it's the right thing to do, and I don't think anybody will wish himself or herself. But when you start taking it and continuously taking it, you feel that that is the solution to your problem. You don't want to leave medication anymore. So, but how does CBT work? It is considered the gold standard of psychotherapy. Yes, the gold standard, the best of things to do first, you know, and it works out to help most people, you know, and it helps. The CBT is, as we said, is a type of psychotherapy, you know, that is help people to to be, you know, to identify whom they are, identify what is wrong with them, and be able to understand, because now it's talking face to face talk with the person that is into anxiety or going into depression. And it also helps to change unhelpful thoughts. It helps to change those negative thoughts that's always embedded in somebody's, you know, idea, in somebody's mind and heart every time, you know, and feeling of and behavior that contributes to anxiety. All those negative thoughts, all those negative feelings and negative behaviors that somebody with anxiety exhibit, with CBT you'll be able to identify them and change them. Okay, so it is really good, it works out good if on time you make people know what is you're going through, and discuss with people, and then seek advice, seek counselors, seek therapists, because of these therapists and counselors are the people to carry out of this CBT to help you come out of anxiety. You might not go for medication if you start on time. Okay, and it said it focuses on teaching a specific skill, that is the CBT, the cognitive behavioral therapy. It focuses on specific skill to manage your anxiety symptoms and gradually return to activities you have avoided. You know, it helps you so much that it will teach you skills, you things to learn newly, so that you'll be putting them into practice to manage gradually, and you know, the symptoms of anxiety. Then you gradually return to activities you have been doing that you have not been able to do because of anxiety. Isn't it good? It is good. CBT is very good to manage anxiety. Yes. And why is it very effective? It is noted to be that it is a short-term treatment, and it can help you develop coping mechanism and strategies to manage anxiety in long term. You see, it is short term. It's not a continuous something that you just, like when you go into medication, you keep taking medication every time you want to take medication. You are now known as somebody who is depressed. You are always on medication and things. But with CBT, it is a short-term treatment, and then it helps you to develop that coping mechanism that will help you and the strategies to help you to manage anxiety in the long term, you know, so that you gradually come out of it. Okay? Yes. And what are the types you can have for CBT? Exposure therapy as well. Exposure therapy. Gradually exposing yourself to things that triggers anxiety. You see, these are the methods. Exposure will expose you to gradually. These are things you'll be carried along with. You're not gonna do it on yourself. You'll be told what to do. You'll be told how to do it. You'll be taught, because it's a skill you're gonna learn on how to do this, to carry out all these things, you know, to expose you to get you to that whatever is triggering your anxiety, to get you to get to that thing again, and then you get used to it, that it will not trigger off anxiety anymore onto you. That is the good thing about it. and then it teaches you relaxation techniques, because you're asked to relax as one part of coping. Then CBT, in carrying out CBT, you'll be able to taught to learn how to relax, the techniques to use in relaxation, learning techniques to calm your body and mind. All these things will be taught to you. You will be taught also how to be mindful. Remember, we talked about mindfulness is one of the coping mechanisms to asking you to live in the past. It's a mindfulness based therapy helping you to focus on the present moment, to reduce rumination, instead of you to go back and rethinking and rethinking, rumination, and worry. Keep on worrying, keep on going back and thinking about what happened in the past. You just kept the past to the past and face the present to bring yourself out of where you are. With this therapy, it is really, really good. And this will help to reduce the worry. And then gradually you are coming out of anxiety. Yes, a lot of people have really testified how the CBT helped them to come out of anxiety disorder. And then when it comes to medication, I don't want to go into medication so much, to be honest, because I'm not going to mention any medication for anybody to come out here and now start going. If some people, some part of the world, they can buy medication over the counter without being having prescription for it, which is not allowed, which is not good, which shouldn't be. Buying prescription over counter without doctor's prescription and without being guided. There are types of medication quite all right to use, which some of the groups of them, we have them, but I'm just mentioning it in passing. But when it comes to that, your doctor will take you through this, through antidepressants, benzodiazepine, all those things. There are so many of them, SSRIs and the SNRIs, so many of them, But the thing is, it can help to regulate, the transmitters in the brain. Yes, the medication can help that, and in the brain that they play the role in anxiety. But first and foremost, the CBT usually help a lot of people before you start thinking of medication. But if it is possible, the best thing to do is to avoid medication. It can only be if CBT does not work for anyone. And we pray that CBT will work for people so that they will come out of anxiety. Instead of going into medication, which can make them to be dependent on medication and be addicted to it, which is not right. Okay? Actually, some of these medication do give temporary relief and the person is back to, whatever. Short term, due to risk of, dependency and risk of addiction, as we're saying. Some people, they might not be allowed to continue it, and it's not a medication you can go and buy over the counter to eat. In developed countries, it has to be, prescribed for you to have. And medical doctors will also like you to start getting out of it, what is called a sort of withdrawal period, so that you don't depend permanently on medication. And as I said, the right thing to be is to be take the CBT treatment and get out of anxiety. Just be serious with it and be mindful and put your mind into it, that you will be okay with it. And you will, if you put your mind to it. So, but we'll just mention it that yes, people go on medication for anxiety and depression. Okay? There are so many medications anyway. As I said, I'm not going to start mentioning them. It's not necessary here. What we are bringing our awareness. We're not treating anybody. I'm not recommending any medication for anybody here. Please get me right. I am not making any recommendation, and that's why I don't want to mention the medications here. The names of the medications that can be used. There are quite a lot of them, depending on what your doctor wants to give you and what your body system can tolerate. I'm not going to mention them because I'm not prescribing anything and I'm not treating anybody. I'm not a doctor anyway. I'm only a nurse, but I'm only bringing our awareness, okay? It's only a teaching how you can be helped and what you can do to avoid going into depression, anxiety and depression. Okay, so as we said, it can only use medication are often used in conjunction with CBT when symptoms are severe and persistent. Otherwise, CBT is always preferred, and a lot of people benefit from CBT. Very important thing I want to do today. If your medication, make sure you discuss the risk of your medication, the benefit as well with your doctor, and follow instruction carefully, judiciously. Don't take the medication anyhow. Follow exactly what your doctor says you should do, the way your doctor prescribe it for you. If you are taking the medication and you find out that you're having some complications or side effects, or as maybe, please report to your doctor immediately. Don't keep quiet. Very, very important. Then other things, as we said, this is generally, now to recap, is that make sure you are exercising. Mindfulness, stay at the present. Very, very important. Relaxation, healthy lifestyle. Make sure you're eating balanced diet. Sleep well. Limit alcohol, smoking, drug, caffeine. Okay? And have social support. Talk to friends, family, and therapists for emotional support. Do not keep it to yourself. Okay? Make sure you're having people around you. Make sure you are having good friends around you. Make sure your family members are around you to help you. And please try to avoid those things we have talked about that triggers anxiety. And I pray that as you go through this and listen to this my video and watch it to the end, you will be able to gain one thing or the other to help you or help some other person going through anxiety and depression. Thank you very much for watching this my video, and please don't forget to subscribe to my channel if you have not, and please give me a thumb up and make nice comments for the video. Okay, and finally, please share it out, share it to your friends, and on social media, and let people be aware, because not everybody knows what to do, and not everybody knows when anxiety is setting in with depression. And thank you very much, and I'll see you in my another video. Thank you, and bye for now.